The whole genome sequencing is continuing to play a key role, and ESR is rapidly sequencing and analysing genomes on a daily basis. We have now 80 genomes sequenced, all link to the outbreak, and there are several mutations that are appearing that are helping to identify subclusters and again help us get around those particular subclusters. The majority of cases in the outbreak are now of Samoan ethnicity, and in large part that's a reflection of the largest subcluster, which is one centred around the Assembly of God Church in Mangere, which has approximately 58 cases, or to date 58 cases linked to it. Investigations are ongoing there. And I would just like to sincerely acknowledge the Samoan community and indeed the wider Pacific community for their response to the request for testing, and that is proceeding very well. The second largest subcluster is the network of cases that surrounded our very first cases. We're calling that the Birkdale Social Group, and that has approximately 23 cases in it.
Jenna.
Bloomfield, the concern that vaccination rates for Māori and Pasifika are really low. What's the government doing to help lift them, specifically because this outbreak seems to be affecting the Pasifika community?
Well, before the outbreak started, we already had an idea of what the vaccination rates were by each age group, and actually for Pacific they were similar to or slightly higher in each age group in the Pacific population compared with non-Māori, non-Pacific. For 55 and over, for Māori, they were comparable as well, either approximately the same or higher. It was the younger age group amongst Māori where the real focus needs to go. And there has been from the start, and there are increasing efforts to reach into both the Māori community but also really engage with the Pacific community, and especially in Auckland. I dare say the rates were lower in South Auckland for Pacific than in other parts of the country. So as you would anticipate, there is a big effort going on now to target that community.
Pushing for a first dose first approach where Māori will be prioritised with first doses. Is that something that you've looked at?
It's certainly something we have already had a bit of a look at, and in fact one of the reasons why we advised and why government decided to extend the interval from 3 to 6 weeks was to allow a greater number of people to have that first dose sooner, and that has already paid dividends.
And bear in mind, Jenna, from the 1st of September, everybody is now able to book their vaccinations, and that's when a lot of that targeted work to get alongside Māori and Pacific community groups really kicks in, because that's that younger population where we know there's a higher percentage of Māori and Pacific people within those younger populations. So you can expect to see those groups really ramping their work up. Claire.
Hello.
Nice to see you.
The church cluster that you referred to, about 58 people in it, is that the number of people who were at the church who now have COVID, or also their household contacts and things like that? Do you have more of a detailed breakdown of that? And also, is there any indication yet of whether AUT cases came, or any other smaller clusters which are building up to be clusters?
On the church cluster, that is a combination of people who are both at the service on the 15th of August and household and close contacts. For example, of our 7 cases in Wellington, 6 of those are either people who were at the service or are household and other contacts, close contacts. I don't have a breakdown of that, but that's information we'll be able to provide. And I'm sorry, I don't have any further detail about the AUT-associated cases. What we do have is about 6 locations of interest, or I guess what we'd call subclusters. The 2 biggest ones are the ones I talked about, the Birkdale sort of social grouping and the AOG grouping. The others are much smaller.
And just on the church service, how many people were at that service, and how many of those people have been tested? I guess how many more cases do you expect, or how big, I guess, do you expect that cluster to grow to?
Yes, so we're still working with the church to get a firm number of the denominator there, and the reason for that is it was essentially an assembly of the assemblies. So there were, I think, 27 different church groups who met for that service, and including some people who travelled up from Wellington. So it's quite a bit of work to get the denominator. What I can say, there are well over 500 people who have been tested as part of that cluster. And then, of course, in addition to those who are actually at the service, there's getting a handle on all their close contacts, particularly the household contacts. But that work is proceeding apace just to get that denominator for that cluster.
Just to make sure we fit everybody in, we're just going to come down the front, Luke, and then we'll go up that way, come back to you guys.
We have heard reports that MIQ were tested positive for COVID. Is there any more information we can have with that?
The only reference I think you could be making is to the case that's been mentioned at the Novotel in Ellerslie. Is that the one that you're referring to? Yeah, so look, an MIQ staff member at the Novotel in Ellerslie did test positive yesterday, but they didn't test positive at work. They were a close contact of one of the clusters that we've been discussing today. I believe they work for one shift, and all of the people who were in work that day on that shift are all now doing exactly as all other close contacts are doing. They're isolating and getting a test. It is not related the other way. So the infection didn't come from the MIQ. It was a person who had it and went and worked there.
Māori Pacific Health experts has come out again criticising vaccination rollout. They said that there's been no real genuine engagement from the start. One that they've been going as far as to say is this latest outbreak is completely prevented should that happen. What's your response to that?
Well, I'd say I've got a different view on the first comment there. I think there's been enormous engagement with Māori providers and Pacific providers with Māori and Pacific communities right from the start of the program, and that's been a big focus for us. I recognise the concern about Māori and acknowledge and agree with the concern about our Māori and Pasifika communities because they have higher rates of pre-existing conditions, and we've seen already, for example, in the outbreak last August, that they are more severely impacted if there is an outbreak. We're seeing in this outbreak over 50% of our cases are Pasifika. So it is very important these communities get vaccinated, and that's why we've had initiatives right from the start designed to ensure that they can access the vaccine.
Particularly, what's your advice to close context of the cases of the AOG Church, given the stats for overcrowding and stuff?
Yes, and we discussed this with the Public Health Unit today, that every one of those families that is involved in that cluster, so that has got cases, there is very specific support going in to ensure that, first of all, well, in the first instance, all cases are taken to the quarantine facility so other members of the household can isolate safely. Second, that their welfare and support needs are met. And third, if they can't isolate at home safely, we have a dedicated managed isolation facility that can be used as well.
Just down here, yep.
Just to jump onto that, what reassurances, Dr. Bloomfield, can you give to the Pacific community? Because I think when you revealed yesterday that more than half were Pacific, a lot of the Pacific community were kind of like outraged because here we go again, Pacific people are kind of this are a focus of the outbreak. What reassurances can you provide that that's not the case?
Well, what I can say is that the reason we have a large number of Pacific cases, and particularly Samoan, is because of this particular cluster around the AOG event. What I can also say is both this time and also as we've seen in the past, the Pacific community is very good at responding to the call to test and isolate, and we've seen great engagement with all those churches to actually identify who was there and isolate and get those people tested. So I can provide an assurance to the Pacific community that not only have we and will we continue to work with you, but secondly that, based on the track record of the Pacific community, we will get to the bottom of it and we will make sure that we get rid of COVID in that community. On the issue around misinformation around the seriousness of COVID-19, the comparison that was made by Professor Skegg a couple of weeks ago I think is apposite. Scotland, similar population. If we had followed the route they had, we would have had around 10,000 people die by now in about 20 months. Annually, we have around 600 influenza-related deaths. So there's a magnitude of difference, and that's not counting all the people who may have been infected, many of whom we are seeing from studies around the world may have ongoing symptoms, so-called long COVID. It is a far more serious illness, and even in the UK now, with the rates of infection they have with a high vaccination rate, it would be the equivalent of around 9 or 10 deaths a day in New Zealand. So you extrapolate that out, that is still way more than we get annually from influenza.